Cancer already kills more people globally than HIV/AIDS, tuberculosis and malaria put together, according to specialists. The World Health Organization forecasts that last year cancer killed nearly 8 million people worldwide. By 2020, there is likely to be 16 million new cases of cancer, 70% of which will be in developing countries, affecting both the young and old.
Nobody really knows precisely the burden of cancer in East Africa.
Dr. Jackson Orem, the director, Uganda Cancer Institute, confirms that over 1,500 children are diagnosed with cancer in Uganda annually. The cancer cases reported at the facility have also increased from 15,000 in 2010 to 33,000 in 2011, with children cancer cases contributing to about 5%, and most of these children dying. The worldwide average cancer-related infections is about 22% in Africa, with 40% of cases reported in women and 30% in men.
In Uganda and in the East African region or Africa, we have a very high burden of infections, viral infections especially.
A disproportionate number of cancers in Africa are caused by infections such as the hepatitis viruses B and C, which causes liver cancer, Kaposi sarcoma, and the human papilloma virus, which causes 98% of cervical cancers.
From our observations here, more than 60% of the cancers that we have associations with viruses. A case in point being one of the cancers that's commonest in men called Kaposi sarcoma, which is related to infections, and commonest to a virus called Kaposi sarcoma herpes virus, and also the commonest cancer in women, cervical cancer, is also related to an infection, human papilloma virus. And then lymphomas, of which Burkitt's lymphoma is just one, but there are a host of others which are also related to infections.
But in the face of scarce resources and many competing priorities, many people, especially in the rural areas, haven't done anything on the disease. To mitigate the already precarious situation, the Uganda Cancer Institute has embarked on a research to be able to identify major causes so as to help.
One of the major foci of research in the institution now is infection-related cancers. And so that is through collaboration with one of the international organizations that we talked about. But also Uganda Cancer Institute, in its own right, has become one of the trial centers of a renowned group called the AIDS Clinical Trial Group.
When they talk about even health issues, which requires funding, and if this funding are coming from donors, for a very long time actually, cancer or the non-communicable diseases have been left out of that because they don't see those as important areas where they should put investment, not only for treatment but even for research.
With the establishment of the East African Health Research Commission, there is hope on boosting research on the disease. Zahara Namuli, NBS, Sunset.